to remember, or providers to remember, your small intestine and your large intestine has a drastically different microbiome. So the microbiome of your small intestine, if you take a scope and you look at how much bacteria is at the bottom of the small intestine, in a mill, there's about 10 to the third of, or 1,000 bacterial species of microbiome. If you take that same sample at the top of the large intestine, there is 10 to the 12th or a trillion bacteria, distinctly different, right? The other thing that it's super important to remember is not only is there a different amount of bacteria, but there's also a different population of bacteria. And the problem with stool testing is they're incredibly effective at figuring out what's happening in the large intestine, but they have zero accuracy at figuring out what's happening in the small intestine. So, weird fact that most people don't know, your small intestine the microbiome of your small intestine actually has more in common with a microbiome of a mouse than it does with the microbiome of your own large intestine. The structure of the small bowel is completely different. So small bowel has something called colonists and enterocytes, and large bowel has colonocytes, different molecules that do different things. Small bowel's job is mainly to absorb nutrients and break down and digest. Large bowel's job is to ferment and to absorb water. So you need different functional cells. Also, because there's so much less bacteria in the small intestine, so the analogy that I give to patients and providers is the analogy of a house, right? So if we're combining, you're looking at your bowel as a house, we've got the house, like the walls of the house, or the floor of the house, right? That's your colonocytes or your enterocytes. Then we've got the foundation, a thick layer. That's the mucin layer, right? That mucin layer is a protective barrier that protects the body from the microbiome, either the dirt or your microbiome. And if the small intestine has one layer of mucin and the large intestine has two, they are drastically different makeup. So when we're working up a patient, if we're only looking at their large intestine, you are going to miss that whole picture and you are not going to be able to move the needle. And, it's a little bit few and far between of women who are going through peri and postmenopause who are not going to have some kind of digestive changes because the hormones are no longer in the play. And so that's super important because when they come in, you want to be prioritizing what is the right thing to be working on. Do you need to be doing a stool test or do you need to be doing a breath test to figure out what's going on in there?